remember? Huh?
This would be like, you normally do this on your regular 6-month training, so you would just let them know that we were going to be polishing their teeth today, if that's all right with them, and what's going to be happening. And it might take a little.
But this stuff doesn't really have.
Do you want to record and I'll send it?
Hold on, I gotta remove something.
Oh, yeah, sorry, that was me.
We need to, usually you gotta cut this one off, guys. It's an auto matrix.
I left that on from class.
Nice.
Sorry.
Yeah, I'll have to cut it off. Or I'll just have to skip that tooth for now. I'm not gonna. So you're gonna have to get the cutters and cut that off, remember?
Yeah.
Okay. Anything else in there? Good. Alright, so her patient's named Bob because she told me so. Right. So Bob, today you're just here for your cleaning. We're just gonna get your teeth all cleaned. Do you have any questions or concerns? Nope. You're good. We're gonna review the health history, okay, when you have your real patient. This comp is literally just the polishing section. Okay, getting you prepped. So the first thing you're gonna have to do is also paint your Pepodont teeth. Okay. This gets all over everything, so be really careful. And I'm painting all over. I'm not being as nice as I am with my nail polish, as you can tell. Okay. So with this stuff, it will go into the grooves. You're not going to be able to get it out of the grooves, or if you have a composite filling or anything like that in here, it's not going to, it's going to stain around the margins of that. Okay. Okay. But you really want to coat all this so that you get used to polishing all sides of the teeth.
Before you guys use this fake plaque, make sure the lid is screwed and just kind of shake it because it does separate. There's like
Yep.
a little alcohol in it and then the pigment. So just kind of shake it a little bit before you paint it, okay?
Yeah. I shook it and then we jumped ahead on how
That's a little like.
Because you may be like, why doesn't it look like what it did on Miss Nicole? That's just, you gotta shake it up again.
Okay.
But make sure the lid is tight.
That would not be good.
I might even need you to paint my nails.
This is not the best. So the most areas missed, I will say, on comp is the
Distal of the last molar, right?
distal of the maxillary. Okay, and sometimes the gingival margins in certain locations, particularly the back teeth. Okay. What else does your comp say? What's the next part?
Donned appropriate PPE.
Okay, which I already did.
And then each quadrant demonstrated an adequate clinical position in ergonomics and intraoral / extraoral fulcrum.
Okay. So you can use both fulcrums. Okay, I put that over there. Obviously, you're going to put all this where you need it. Okay.
And ladies, let's make sure all of our cords are untangled again like we did on Tuesday for tomorrow.
Someone put the wrong tray over here, the color.
That came from the cover.
That's not actual trick.
Oh, like the basic.
No, that's mine because I already had it out.
Oh.
It was already out.
I was like, it's the wrong color.
I'm looking at the tray. No, next to
I was like,
Y'all was like,
"Trey,
huh?
this is
no
my
tray doesn't
tray."
fit. We're gonna have an issue. Things are gonna fly.
I'm gonna make sure. Okay, so with this, I would practice before you go in the mouth, which you're obviously gonna do in the Pepodont. Okay, what you don't want to do is this. You don't want to do. You don't want to do that. We're not. Stop. Go. It is a nice, consistent flow. So you're gonna go 1, 2, 3. Nice slow cruise control. Okay, and then if you come out, you just stop. Alright? So it takes some getting used to a good flow on these. Why is it not? Oh, let me put
Why do you not go full force?
You're gonna burn out the rubber brush and then you're gonna have to get a new one. Like it's gonna.
What are you gonna do to your patient?
What are you talking about the brush? We're talking about the gum.
Well, I know, but like the brush will also burn out. Like you're gonna have to get a new one and then you're gonna waste a lot.
Oh, I need an air water tip.
You're gonna remove lots of enamel because you're using an abrasive agent, right?
Sorry, my goodness.
That sounds good.
And I get her light. Thank you. Does this one work well?
Hi, Wendy.
And then remember, when you have a real patient, you're gonna flush this for how long? Okay, we'll pretend I did that. Water is not on for this, okay, on your rheostat.
That'd be a fun mess.
You notice in your book, it tells you where to sit, where to fulcrum. It doesn't have to be exactly to the T to that, as long as you are fulcruming somewhere. So it can be an internal or an external fulcrum. So really pay attention. I try to do it internal if I can, and then only external on occasion. This isn't sharp, but it can still hurt the patient if I slip onto their gums or whatnot. Okay, these are probably old, so I might have to wet it because I don't want it so dry that it's going to ruin the patient's gums. But the new paste hopefully won't be this dry.
You can also use your cotton wire forceps to kind of like jumble it up a little bit.
And you can mix it. Okay.
It's expired.
That might be
It
a bit-
doesn't tear.
Might be a little bit too wet, but I'm not gonna use all this, okay? So then I can like turn this on, scoop some up, okay? I got it a little bit too wet. All right, so now I'm turning them away from me. I start on the buckle every time. I'm gonna do an external here. And you can have a cup holder, but I kind of just hold mine here. Now I'm starting on the distal and I'm swiping 1, 2, 3. You noticed that I went all the way to the gingival third to the incisal edge.
Everybody take a moment to
Okay.
take turns
See?
to see her do this.
Yep. My cup is flared. So I went in between the contacts as much as I can, okay? So now that I'm up there, I might need some more paste, which I do. Okay. I can start the fulcrum now.
Let Holly get in there.
Okay?
Can you see?
Yeah, it's all zoomed in on the phone. I can
Just
watch. I
making
can.
sure you're seeing how that
So now I'm going to go, I did up to number 8, I did the first quadrant. So now I just did the buckle. Now I have to do my occlusal and lingual, right? So then I'm gonna go to my occlusal. Sometimes I go a little bit harder. And you're just going around each cusp. And I have to adapt the cup to the cusp, because otherwise you're not gonna get all sides of the teeth. Might need more paste. Okay. Yeah, I might have to actually use my mirror because I'm on the lingual. Fulcrum. Yeah, that did wiggle me. I was like trying to put pressure on it. I was like, what is going on? So my cup is flaring. This is not ergonomically good. It's already killing my hand. The cup is flaring as I go to the gum line. Okay. So now when I'm done the first quadrant, what do you think I'm gonna do? Rinse. Okay. And it's air and water. This won't rinse off, by the way. All this stuff, it's gonna stay until you clean it off. Okay. Usually doesn't rinse. So now,
You said that stuff in the tips and stuff ain't gonna come out.
in the grooves, it won't come out. You have to use a Profi brush to get it out. So then, let's see what I have here. I got by the gum line, but yeah, in the grooves, they're not going to come off. And if there's like a groove on the sides, they're not going to come off. So now, what do you think? How do I get the inner proximal? I'm gonna floss, right? So we'll do that at the end after we polished, all right? So then I'm gonna leave this for you guys, but then you would just do the same thing and continue to this side. I'm gonna turn them towards me for the buckle, straight up, and then the lingual, you can have them turn back away and polish, and then you're gonna go down here and polish, okay? Do you guys wanna see it one more time? Do you wanna see a mandibular or a max?
Yeah.
Okay, so I'm gonna do this side because she has a band on that one.
Sorry.
Okay, so mandibular, if I'm on the buckle side, they're gonna be away from me again. And make sure you have this cord to where it's not pinching it's giving my hand a cramp. So you have to have this cord to where it's not tugging. I have it away,
You need more paste.
okay? Oh yeah, we need more case, good call. Yeah, I'll actually have to look at it. Okay, so now I can fulcrum here. Now if you missed a spot, you can go back over that spot, but I don't want you to go over the same spot like 3 times. It's not gonna come off, it's not gonna come off. But you can go back just once to see if you got it. Okay. Then you can kind of move your chair where you need it. I'm not gonna be able to get where I want on this, but. And notice I'm just swiping 1, 2, 3, like that, okay? Then you do the occlusal again. This is not all gonna come off on the grooves.
Can you pull the cheek down or no? There's a book in you. I'm sorry.
Oh, this way.
I was trying not to stop you, but I saw one over.
Okay, I'm glad you got it.
Now you also don't want to press so hard on this that your cup won't spin anymore. If your cup's not spinning, it's because you are pressing way too hard. Okay.
Can you see in the video?
I'm still fulcruming.
Why is she going from the gingiva to the incisal edge, gingiva to the occlusal edge? And why is she not going
You don't want to
start
push
with
it
the-
down into the gums, then it makes it harder.
Yep.
You don't want all that grit in the sulcus of your gums. It won't feel very good.
All right, and then when you're done each quadrant, again, you're just gonna rinse.
Yeah, she does.
Yeah, I
She's laughing
do.
right now.
I do.
And then using air and water. You're gonna have to use air and water to get all this paste actually off. in that quadrant. So you'll notice the composite that was done back here, or sealant, totally, it's completely stained. It's not gonna come off, so don't keep going over it.
What stain?
Okay.
Sealant.
See back here?
Oh, no, I can't.
It stains it.
Can you see it?
Okay.
I don't know.
Yeah.
Okay, and the grooves will be stained. I could probably can get this groove here if I were to flare my cup inward. So I would probably go back over there. But now flossing, remember what I said about this? How do you do the floss?
You wrap it around your middles and your pointers guide it into each tooth.
Okay, good.
And then you wrap around that tooth. Do
So,
that.
and I'm gonna start where I started before and do the same routine every time. Okay, so I'm going to floss the distal side of the very last tooth. Wrap up and make your C come up. See how I got some off? You see pink on there? It will actually get that plaque off. Then I wrap and go over again. Wrap my C, mesial side, and then it'll come up a little bit, distal side, up and out. And that's how you get all that rest of that plaque off. And then you just keep going without coming up until you're ready. And I am really wrapping it around good to make sure I get all the plaque off. Because that's the only way you're gonna get it off the inner proximal. Okay. And then so that one came up on that one. Running out of phosphorus. Probably want a little bit longer piece next time. Maybe an arm's length. Yeah, because I keep moving it so I don't introduce the plaque back into the next area. And then, I mean, if it becomes worse, you can just kind of wipe it, but, okay. So that's that, her tooth's falling out. Whoops. Okay, so there's some grooves along your teeth, the margins of your tooth. That's actually a margin. It's gonna stick in there with this stuff. You're not gonna be able to polish all that off. You'll notice there's a catch with the Explorer. You're not gonna be able to get that off, okay? Might have been able to get that. Or if there's a divot or anything, or something stuck, like flash, there's something stuck right here, so that's why it's stuck there. Okay, I would have to scale it off. Okay? So there's still some on there for you guys to try. What else is on the comp?
Maintain asepsis throughout the
Okay,
procedure.
don't touch your face. Cross-contaminate things.
Might give you some things to put on the back of your ears to tighten those on your face.
It's gonna be really critical when we get into Zella's mouth, but
I know. I'm
infection
always like,
control's automatic.
trying to push my
Anything
glasses
else?
back up.
I think that was it, right? Yeah. So this is pretty easy, not too terrible. Okay.